First reading, Senate File Number 4025, an act relating to opioids. Pursuant to Article 4, Section 19 of the Constitution of the State of Minnesota, Olson L. moved that the rule therein be suspended and an urgency be declared, and that the rules of the House be so far suspended so that Senate File Number 4025 be given its second and third readings and be placed upon its final passage.
I call on the member who is the author of the motion, Representative Olson.
Thank you, Mr. Speaker and members. So yes, this is my motion. House File 4025 passed unanimously in the Senate yesterday, and this is the opioid settlement legislation. And so we want to take it up today in order to be able to pass it so that we can start leveraging these funds. And so I'd ask for members' support of the motion.
Further discussion. Representative Baker.
Mr. Speaker, I also encourage members to support the suspension of the rules today. It's an important bill. Let's get to it. Thank you.
All those in favor say aye.
Aye.
Opposed say no. The motion prevails. The clerk will give the bill its second reading.
Second reading, Senate File Number 4025. Second reading, boom.
Second reading. Discussion.
Mr. Speaker, this is Representative Olson. I'd like to present the bill if possible.
To the author, Representative Olson.
Thank you, Mr. Speaker and members. So House File or Senate File 4025 as before us is the opioid settlement legislation, as I mentioned. So for those around in 2019, you may remember the legislation that Representative Baker, myself, Senator Eaton, and Senator Rosen worked on, which was a pretty big piece of legislation, landmark really, which established licensing fees on opioid manufacturers and distributors and dedicated an account for these funds to be put into to be used to combat the opioid crisis. And with that, we created the Opioid Epidemic Response Council, which Representative Cagle and Representative Baker sit on for the House. And so they do grant making to get these funds out to combat the crisis. So when we created this legislation in 2019, we knew that we'd likely be seeing funds coming in from litigation into the state of Minnesota, but we didn't really know what the terms of that would look like. And so we put some pieces together to be ready, but we knew some things might need to change when those funds came in. So last summer, the state of Minnesota joined nationwide settlements with opioid distributors McKesson, Cardinal, and AmerisourceBergen, and manufacturers Johnson & Johnson. So those, and we know those are the actions that fueled the opioid epidemic, as we discussed at great length back in 2019. So Minnesota is expected to receive around $300 million from these funds. And I just want to say a special note of gratitude at this point to Attorney General Ellison for fighting hard in those settlement discussions and to ensure that the release of the documents was a part of that settlement. So I just wanted to note that. So the complex settlement requires the states to come to agreement with local governments on certain terms. So the Office of Collaboration and Dispute Resolution convened various stakeholders, including the Association of Minnesota Counties, the League of Minnesota Cities, the Coalition of Greater Minnesota Cities, the State of Minnesota, and the Attorney General's Office. They worked together to reach an agreement on funding distribution, and the agreement calls for counties and cities to receive 75% of the settlement funds and 25% to go to the state. So coming out of the stakeholder process, and as mentioned earlier, we knew we'd need to make legislative changes in order to capture these funds. And so that is what is before us in the bill today. So it implements the 75-25 split, which also establishes two accounts within the opioid fund, one for the registration license fee that we put in place in 2019, and one for the settlement account, which we're describing now. The legislation also released funds. Current law specifies that the settlement funds must be deposited in a separate account in the state treasury, and funds only go to the opioid funds once the Board of Pharmacy fees sunset. So Senate File 4025 2025 makes changes to get these funds out right away in combating the opioid crisis as they come in. Another piece in this legislation is the claims bar. In order to maximize how much settlement money Minnesota receives requires barring subdivisions' remaining legal claims against the opioid companies. So additionally, existing law is kind of unclear regarding whether settlement funds go directly to local governments could count towards the $250 million in the sunset. So under Senate File 4025, all settlement money counts towards the sunset number. However, we did negotiate with the Senate to ensure that we could extend out that sunset date until July 1st, 2024, from July 1st, 2024 to July 1st, 2031 to ensure we had that full $250 million captured before we started to lower the registration fees. So further, the bill requires municipalities receiving direct payments from the settlement agreement to report annually to DHS on how the payments were used on opioid remediation, and the report must include data and measurable outcomes on expenditures funded with these payments. The ORAC will review this information, and that's the group that Representative Cagle and Representative Baker serve on our behalf. And lastly, the bill includes additional funds to DHS to collect, collate, and report data submitted to monitor and comply with the reporting and settlement expenditure requirements by the grantees and the municipalities that receive this money. So a technical bill, but really a bill that the intent is to, as quickly as we can, put this anticipated $250 million to good use fighting the opioid epidemic. And so with that, I will turn it over, if possible, Mr. Speaker, if you could also call on Representative Baker to describe the bill.
Okay, I think there are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File number 4025.
Third reading. Discussion to the bill. I recognize the member from Anoka, Representative Cagle.
Thank you, Mr. Speaker. Members, the most important thing this bill does is get money to the organizations that are fighting to save our loved ones from addiction. We have a crisis now, and it's vital that once the settlement money comes into our state, that it goes right to the boots on the ground who are fighting to save our loved ones. The Opioid Epidemic Response Advisory Council has taken a thoughtful and deliberate approach when deciding how the money is going to be distributed. We really look at things like promising practices, gaps in state and federal funding, culturally specific care. And so these organizations are helping in our communities and making sure that we're adapting to meet current needs and providing support that no doubt saves lives. Treatment and recovery saved my brother, and this bill ensures that we can get the settlement money to help people most affected by the disease of addictions. Please support this. Thank you, members.
I recognize the member from Candy, Ojai, Representative Baker.
So members, this bill is kind of that next step in the process of helping our members in the recovery community, in the workforce community that are trying to help people get out of this horrible disease of addiction. Most of you here know this is a very personal story for me. Writing this legislation 4 years ago was really a sort of a life-changing thing for me because nobody in the country had done a bill like this before. There was a lot of members here that helped me get it to a certain point, both senators, representatives, both sides of the aisle, and in 2019, again, with the help of Representative Olson, we got it past the finish line, passed it, one of the first in the country to relook at our licensing fees and how we do our medicine and license our pharmaceutical companies in Minnesota, and we took that money and we're doing some really good things with it. House File 400, this is sort of that 2.0. As Representative Olson very clearly stated, what this bill does, it now creates this new form of revenue to the ORAC Council. Again, ORAC stands for the Opioid Epidemic Response Advisory Council. I happen to be honored to be the chair of that ORAC Council right now. And we do a lot of really good things in Minnesota. The dollars that comes into ORAC are used for local grants to nonprofits to counties, for-profits do it for workforce, education, prevention, law enforcement, and we're doing a lot of good things with this. This council has the ability to directly appropriate this dollars. Unlike most advisory councils, we have, and thanks to you legislators, we have that authority to do that. So what this bill does today is we're getting ready for the lawsuits that are coming into Minnesota. The Attorney General's office has done a very good job with the help of Eric Maloney, Evan Romanoff, Keith Ellison, and John Keller have worked with a number of us to make sure we got the language right. We worked with the Association of Minnesota Counties. We worked with the League of Minnesota Cities and the Greater Coalition of Minnesota Cities to make sure we got the language right, because every single county agrees to this, because they're going to get 75% of the dollars coming from the lawsuit dollars going right to their public health departments, and we're going to do some good things, and we're going to, as the ORAC, we're going to help them collaborate with other counties nearby. We're going to share our wins and what programs are working well with the results first portion of this, that we are also seeing some good programs that are moving some things in the right direction. Also, we clear up the sunset provision in House File 400, so we know now when we're able to lower the fees to the pharmaceutical companies, the distributors that are paying a higher fee now in Minnesota. We know when we're going to get to that point of $250 million, which was in the original bill, of when we now turn down the sunset portion. That'll be coming up in the year 2031, when we know that's the moment we'll have our money in the bank, according to the structure, because this is an 18-year-long $300 million coming to Minnesota. We just don't get it all at one time, so it's going to take some time. Again, Minnesota is getting noticed for this bill. Recently, again, we had the opportunity to speak to this in Atlanta. They want to know from other states, what are we doing in Minnesota to get the pharmaceutical companies to pay attention? And this bill did that. And now this update is reaffirming what we are doing, because we didn't change a whole lot of anything in House File 400, because we actually worked really hard to get it right first. This is, for me, the best kind of legislation we can all work on together. It thought hard about the members and the seats they represent on the ORAC Council. It thought seriously about putting money into a different fund so we can't go after it, members. And it provided some good leadership, some new looking at a problem that was devastating our communities and our families, from folks that hijacked our medical community to get this thing running the way it is today. So this is a really good moment, and I thank you for suspending the rules so we can get this to the governor's office so he can sign this bill. But again, I've thanked the folks we need to thank. I want to thank my dear friends, Senator Rosen, Senator Eaton, who have been the original authors on this, certainly along with Representative Liz Olson, who was a champion with this when I needed her help the most. She was there to help get this thing over the finish line. So I really appreciate the support, members, to this. It's a day that in Minnesota, the members back in our districts that you know of that have either lost somebody or they're currently in maybe a treatment facility, or maybe they're in recovery. This is a day we're doing some good work for those people suffering from the disease of addiction. Help me with the stigma of what addiction has become. Help me with changing that conversation. And the dollars now coming to Minnesota with lawsuits are going to be flowing better, faster, and directly to our counties with good legislation like this. So, members, thank you. I sure do appreciate a lot of green votes today on this bill, and appreciate your time today again. Thank you, members.
To the author of the bill, Representative Olson.
Thank you, Mr. Speaker and members, and I just also want to echo a few thank yous here. This was a lot of work for this opioid settlement bill over the interim and before, lots and lots of meetings, negotiations, and our staff were there for many of them. So Joe Durheim, Jeremiah Wingstead, and Randy Chun spent a lot of time on this bill prior to session getting it right. And of course, Representative Cagle for her work on the ORAC committee and also helping to make sure this bill was ready to make its way through the legislative process. And to the AG, the Attorney General himself, and all the staff that worked so hard, both on the settlement and ensuring we passed the legislation. They did great work on the settlement and then had to turn it over to us to make it through the legislature, which I'm sure was a little nerve-wracking for a moment. So Laura Takenholtzy, Evan Romanoff, and Eric Maloney, to name three that I work closely with. And then, of course, the Senators Rosen and Eaton, who are on their last few days here at the legislature and wanted to make sure this got done, and whose fierce determination is really unrivaled. And of course, Representative Baker, partner in all of this work from day one, and just in it, willing to work on this in such a collaborative way is so appreciated. And I just want to close by saying, in a letter of support we received from a community organization, they just put it so simply. If this bill passes, the money can be used immediately in funding dozens and dozens of treatment and prevention efforts in our communities that will truly save lives. And so I ask for your support, and I also ask that we don't think this is it. This epidemic, unfortunately, is going in the wrong direction in terms of numbers. And so we need to think hard as legislators in every budget area and every issue area we work on. It is our responsibility to continue to be innovative with the programs we're funding, the types of things we're doing, our ability to go upstream, because it's an all hands on deck moment. And yes, this will be a big piece of saving lives, but we have so much work to do as legislature. And so I urge your support today of this file, and thank Senate File 4025, and thank everyone who worked on it.
There being no further discussion, the clerk will take the roll. Members voting remotely, please vote. Will the clerk please call the names of the members who have not voted yet?
Davids.
David's aye.
Davids, aye. Drazkowski.
Drazkowski, no.
Drazkowski, no. Franzen. Franzen.
Franzen votes yes.
Franzen, aye. Hamilton.
Hamilton, aye.
Hamilton, aye. Hausman.
Hausman, aye.
Hausman, aye. Hollins.
Hollins, aye.
Hollins, aye. Keel.
Keel, aye.
Keel, aye. Kosnick. Kosnick. Miller.
Miller, no.
Miller, no. Moran.
Moran, aye.
Moran, aye. Nelson, N.
Nelson and I.
Nelson, N, aye. Olson, B.
Olson B. Aye.
Olson, B, aye. Sandsted.
Sandsted, aye.
Sandsted, aye. Swazinski.
Swazinski, aye.
Swazinski, aye. Thompson. Thompson.
The clerk will close the roll.
Zhang Jie. Zhang Jie.
Sorry, Jay.
What?
Kosnick, aye.
Kosnick, aye. Zhang Jie.
Aye.
Zhang Jie, please repeat.
Zhang Jie, aye.
Zhang Jie, aye.
Thank you. The clerk will close the roll. There being 119 ayes and 8 nays, the bill is passed and its title agreed to.